Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to discuss smoking and what we can do together to help you quit. Smoking is the most important cause of reversible health problems in our country. When asked, virtually all smokers know that smoking is bad, but most smokers do not realize how bad it really is. The average life expectancy of a white American male who has never smoked is 81 years. The average life expectancy of a white American male who begins smoking as a teenager and who smokes continuously until he is found to have a fatal illness is 64. Smoking on average, therefore, decreases average life expectancy by 17 years. Some smokers may die in a car wreck not related to smoking, while others may die in their 40s of a heart attack. All in all, however, the average reduction in length of life is a full 17 years. How does smoking kill most people? Most smokers think the number one cause of death in smokers is lung cancer. Lung cancer, however, will only kill one smoker in 20. Smoking not only increases the risk of lung cancer, but it also increases the risk of dying of cancer of the mouth, tongue, food tube, stomach, pancreas, liver, kidney, bladder, colon, throat, and rectum. With smoking, there is a 60-fold increase in the risk of lung cancer, a 10-fold increase in the risk of cancer of the mouth and throat, a 3-fold increase in the risk of kidney cancer, a 10-fold increase in the risk of bladder cancer, a 3-fold increase in the risk of stomach cancer and cancer of the pancreas, and a 10-fold increase in the risk of cancer of the food tube. All in all, cancers cause roughly 20% of all the deaths in our country each year. And in those who smoke, cancer is responsible for 30 to 35% of all deaths, and these deaths occur on average almost 20 years earlier than the cancer deaths in non-smokers. Smoking also increases the risk of death from heart attacks and strokes. The more you smoke, the greater the risk and the earlier the deaths. A person who smokes a half a pack of cigarettes per day is 3 times more likely to have a heart attack or stroke than a non-smoker. 1 pack of cigarettes increases the risk 5-fold, and 2 packs per day increases the risk 8-fold. Smoking just 3 cigarettes per day increases the risk 2-fold. Just being exposed to someone else's smoke on a regular basis increases your risk of heart attack and death by 30%. Smoking increases premature deaths due to cardiovascular diseases in 50 to 60% of all smokers, and on average this death is 15 years earlier than cardiovascular deaths in non-smokers. Smoking increases the risk of death from heart attack and stroke 3 ways. First, smoking lowers your HDL cholesterol level. This reduction in your body's natural cholesterol removal system accelerates the buildup of cholesterol in the walls of the arteries feeding your body. Second, smoking increases the tendency for your blood to clot. If your arteries are partially blocked with cholesterol, the final step in the development of a heart attack or stroke is from the formation of a blood clot. A blood clot will be much more likely to form and completely stop the flow of blood to your heart or brain, causing a heart attack or stroke when your blood is made thicker by tobacco. Finally, every artery in your heart is surrounded by a thin layer of muscle. Muscle has the ability to contract and become smaller. The poisons in tobacco causes the muscles surrounding the arteries which feed your heart to contract and go into spasm. This causes a reduction in the space for blood to flow in the artery. If the artery is already partially clogged with cholesterol, the additional blockage caused by this spasm can totally shut off the blood supply to part of your heart or brain, causing a heart attack or stroke. Smoking also increases death from emphysema or lung failure in 10% of all smokers. Deaths due to emphysema are virtually unknown in people who do not smoke. Smoking also reduces the quality of life independent of its effect on death and life expectancy. 98% of all men who see a urologist because of the loss of ability to obtain an erection that is adequate for normal sex are current smokers or ex-smokers. Smokers get ill from all causes more than non-smokers and actually miss 40% more work than non-smokers. Smoking increases the visual age of skin. When asked by independent people how old an individual appears to be, smokers are consistently judged to be 10 to 15 years older than non-smokers of the same age. As you can see, smoking or any use of tobacco dramatically and adversely affects the length and quality of 90% of those who use tobacco. The good news is once a person stops using tobacco, the risk of dying is cut in half. This improvement occurs whenever a person quits. The younger a person quits, the better, but benefit is gained even when patients in the 60s and 70s quit. Fortunately, we now have good help for those who want to quit smoking. The two things that really help people quit are therapy with an antidepressant medication called Wellbutrin or Zyban and nicotine replacement therapy. If a person wants to quit smoking and takes Wellbutrin or Zyban, the likelihood that the person will succeed in quitting increases from 4% to 40%. Wellbutrin decreases the mental craving for cigarettes. When asked why did you quit with Wellbutrin, most ex-smokers stated they just didn't feel like they needed a cigarette. The three nicotine replacement therapies are the nicotine patch, the nicotine gum, and the nicotine inhaler. The nicotine patch is generally the easiest to use. You just place a patch on a non-hairy part of your body for 24 hours and then take it off. You then place another patch in a different part of your body for another 24 hours. The patches should not be placed in the same location for 8 days. This prevents skin irritation. Generally, a smoker should start with the high-dose patch and use it for 6 to 8 weeks, and then decrease the patch strength to medium dose for 4 more weeks. The low-strength patch should be used for 4 more weeks and then off completely. If you smoke with the nicotine patch on, your blood nicotine levels can go very high and make you sick. This has some risk, but the highest risk situation is continued use of tobacco. Hence, it is risky to quit smoking with the patch, but it is more risky not to quit. When nicotine replacement therapy is used in conjunction with Wellbutrin, the quit rate is close to 70%. If a person smokes very heavily, such as 2 packs per day, it may take 2 nicotine patches to get the blood nicotine level up high enough to suppress the pain of withdrawal. My advice to all smokers who really want to quit smoking is to start taking Wellbutrin. 1 week after starting the Wellbutrin, start using the high-dose nicotine patch and completely stop smoking. If you still feel like you need a cigarette, double up on the nicotine patch. Whatever you do, do not smoke a cigarette. Just getting your cigarette use down is not going to work. You have to stop completely. If you want to stop smoking, let me know and I will help you. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.